Hi, my name is Fiona. I'm the marketing coordinator here at Laugh and Learn Autism Therapy in Grand Blanc.
And hi, my name is Trisha Wonderland. I am the executive clinical director at Laugh and Learn.
Yeah, we're so excited it's Autism Acceptance Month now in April, so we're doing a little live. If anybody has any questions, feel free to ask our clinical director. She'll be available to answer some of them. But first, we wanted to kick things off with some things to maybe not say to a parent who has a child with autism, so that can, sometimes if you don't necessarily know too much about autism, some questions or comments might slip out, but here are some things to not say to someone else. So number one, I'm not sure giving your kids all those sensory supports is going to help them in the real world.
Boo.
Don't say that.
Please don't say that.
Yeah. Another one is, if maybe you see a child is having a meltdown or some kind of difficulty in public, why aren't you controlling your child? I would never let my kid get away with that. Maybe not the best thing to say in that situation. And lastly is when a parent is telling you that their child has autism, saying they'll probably grow out of it. This is, once again, not a very helpful statement.
Yeah, and I feel like those are so relevant, right? I hear a lot of families struggling with these components from hearing them from loved ones or friends. And although your intentions might be helpful and good, it can be just hard to hear. So we want to make sure we're always giving grace, especially in the grocery store. We know that's a hard thing for kids in general. And if you're managing any sort of problematic behavior in a community setting, it just adds on a lot of extra eyes and pressure, and
that can be a stressful situation to begin with, and especially when you're hearing these types of things from family members or friends. That's the people that you want to support you the most, and when they say things like that, it can be a little bit difficult. So now we can go into some things that maybe in those situations, instead of saying what I said, we're going to say what Trisha said.
Yeah, so we can say, hey, I see your kid often uses visuals. Can you show me how to use them? We know a lot of our learners use visuals to communicate. It's easier for our brain to process those. And it's obvious to other people when we're showing a picture of what we need or want. They know exactly what we might need or want. So that is something awesome to say to your loved one so you can help support the child. So something else that you could say was, hey, I'm sorry your kiddo's having a rough time, but you're doing great. You go ahead, go support your kiddo. I'll take over here, right? So if we're struggling in the grocery store, just allow them to feel some relief and help them any way that you can. And something else that you can say too is, I'll keep some sensory supports at my house for when you and your kiddo come over. So we know a lot of our kiddos do have a lot of sensory needs, and this helps to promote regulation and just helps them to feel better all around, and just really supports them. So it's awesome when family members and friends can recognize that child needs those things, and just offer it to be available with them at their house. So
fantastic. Yes. So additionally, we did get, feel free also if you have any questions about autism or ABA, give us a comment, we'll answer. But we had a couple that were left on some of our videos. The first one was, how specifically do you define your philosophy in contrast to what is usually coined as just ABA therapy?
Yeah, so we obviously do ABA therapy, which stands for Applied Behavior Analysis. And the way that we do ABA therapy is we want to make sure that we are more patient-centered support. We also take more of a holistic approach, right? We coordinate and collaborate with our PT or OT or SLP, because all of those pieces really impact the child as a whole. We help support the parents in whatever environment that they need, and we want to make sure that what we're working on during treatment also aligns with the family's values and the child's values too. So If you know anything about ABA, you know that a huge thing is reinforcement, right? So we are enhancing those environments with all the things that the child likes. So they're able to meet that reinforcement frequently, and we know if our kiddo really likes Paw Patrol, well, we're gonna have everything Paw Patrol, whether it's stickers, it's the music, it's a car. We want to make sure that we're catering to their interests and things that they enjoy doing as well. And the technician and the staff working with your kiddo, they're their number one cheerleaders. We are on their team to help them be successful and support them throughout that process, no matter what that looks like. So those are a few things that we try to have more of our philosophy here at Laugh and Learn, and really all in all just meeting kids where they're at and help them through that journey. So
yeah, another question that one of our parents had was, what behaviors can ABA help with most? So I know it's kind of a wide question, but what are your thoughts on that?
Yeah, that's a great question. I would say what ABA can help with the most is teaching skills, so skill building. We work heavily on replacement behaviors. So when you're looking at a child that might be having some behavioral challenges, we all understand that they're still trying to communicate that they need something or they want something. So when we start ABA, one of our first steps is, once we can kind of analyze what they're trying to communicate, we can teach them how to communicate that in a more effective and impactful manner for the people who they're going to be around. So a lot of the times it's what we call that functional communication. So we might be teaching them to request to be all done with an activity, or we might request them to ask for more time with an activity. This might look like we're teaching them to request for specific items or activities, getting others' attentions and asking them for different actions like play with me, run, go with me, different things like that. And then once we work, heavily on these replacement behaviors, we see such a positive change with reduction in some of those unsafe behaviors. So I would say, out of everything, if I had to pick one kind of topic or a thing that we work on, would be more of that functional communication, because honestly it makes the most significant impact on our our kiddos.
Yeah, so relating to that functional communication, I know there's a lot, but is there one, like a couple things in particular that you see often, like the most need for, that a child needs to be able to communicate, and that is often what leads to them resorting to those maladaptive behaviors?
Yeah, and for every kiddo, they might struggle with different parts of their environment or different changes that are occurring. So I would say the real common ones are, they want more time with the item, or they want a specific item, and maybe that item's not available, or it's time to transition or move on. But we have to first teach that child how to communicate and reinforce them communicating, even if we really do need a transition or wait. Give them that 5 more minutes with that item. Teach them, hey, I'm going to reinforce you communicating this way. And then we know tolerance is kind of down the road, because sometimes we do have to transition and we can't always take those items. But really reinforcing that functional communication is important. And that might look really different for different kids. So it might be, using a picture card. It might be using an AAC if they have an iPad that they're utilizing with ProLoco or another communication system on there. It might be sign language. They might be asking for all done or approximation of that. Or they might just be saying the first sound, whatever that looks like for that child.
So for parents at home then, if we want to really reinforce them using that functional communication, what is the biggest mistake you see parents making at home, and how can they fix that?
Yeah, so I think that what I see missed the most is just understanding more of the science behind human behavior. So if we're thinking, okay, so, Charlie really wants to, watch a TV show. He wants to watch Paw Patrol because I think that's on my mind today. But it's time to leave. And so what sometimes happens is, Charlie might point to Paw Patrol and we might ignore that request because we're like, no, we gotta go. We gotta go. And then Charlie might start to escalate, right? So he might start screaming, might start hitting, might start engaging in SIV, maybe he's hitting his head. Now he's very distressed and he's trying to communicate, I really want Paw Patrol. And at that time, sometimes as parents, and I'm guilty of this myself, we just want that behavior to stop. We see our child that we love so much in so much distress, we might at that point give them more Paw Patrol. It's a very natural response sometimes for parents to do this, but by doing that, we just reinforced the SIV, meaning it's likely to occur in the future because that is the mode of communication they had to do for someone to listen to them, right? So if we would have reinforced that pointing to Paw Patrol and given them more time, then we would see that pointing to Paw Patrol more frequently in the future because that's what they got when they requested for it. So that piece, we miss, and I totally get it. I'm a parent too. I've made the same mistakes. But really trying to reinforce that communication and giving them 2 more minutes, or 5 more minutes so they're able to give it and maybe even plan for it. So if you have this happen in the morning often or a certain part of your routine, okay, well maybe I'm going to start it 5 minutes sooner, knowing that they're going to request for more Paw Patrol and that you want to honor it, especially when they're communicating in the right way.
So then I'm curious, let's say it's a situation where you really do need to get out of the door or you need to, there's some kind of emergency maybe or something that needs to be done and they can't necessarily have those extra 5 minutes. What would you do in that case to kind of still reinforce that proper communication, but to, still allow for that tolerance, I guess, maybe? What would be something you'd work on?
Sure. So, you want to know, what works for your child's important in this. I can give a lot of different strategies, but, and it might be a trial and error situation too, but something else, hey, we need to get out the door, we cannot have Paw Patrol, that's not an option. Some kids can tolerate, hey, we have to do this first, then you can have Paw Patrol later.
So first then
okay. Statements, the pre-MAC principle. Something else that you could do is, hey, maybe we get creative. Hey, first we need to go in the car, and then you can watch an episode on my phone while we're driving. If your child can't wait, first we're gonna go to the store, then you get Paw Patrol, that might be too long. So get creative, use technology. Hey, it's useful for those reasons. If Paw Patrol is just not allowed, your phone's dead, you need to go, right? Maybe giving your kid 2 other options, and if no is triggering, you don't even have to say, no, we're all done. Sometimes reiterating that and keep saying it can just make things worse. So sometimes it's better just to take 2 other things that they can take with them that are preferred, things that they enjoy. Give them options, give them autonomy, give them choices. That goes such a long way. And then they can select one of those choices, and then hopefully you can get going on your way.
That's awesome. Thank you so much. I'm curious then, a lot of parents have questions about what training kind of goes into staff that are, doing ABA. Is there something that you would recommend that parents look for in ABA clinics to make sure that their child is getting the best support possible?
That is a great question. In-person training, I would really ask that question. Becoming a technician, the changes for the requirements changed in 2026 in January. And they are required to do like a 40-hour training really specific to understanding the principles of ABA, being able to do day-to-day things that we need to do, like data collection, preference assessments, token economy, different aspects of the job, being able to collect data on maladaptive behavior, being able to read definitions. But a lot of clinics do all of that training online, which, again, technology is great. Glad we have it as a tool. But there's something so much more valuable of having a tech coming in, seeing how well they're understanding all of those concepts, especially if they're new to them. We have our own language, folks. It's its own language, it's its own beast. And so, sometimes it's too much for people, and you can't really read that much when you're going on an online training. And there's no hands-on experience in that case too. So I would really look for a clinic that does in-person training, because one, we can work on behavior skills training, which is a technique that we use in the ABA realm where, we're modeling different things, then we watch them perform the different techniques that we're asking, and then we can give them feedback. So that role playing goes a long way with supporting someone learning the field of ABA. So those in-person trainings are huge.
That's fantastic. And then is there something, besides even just the training, that shows to you that an ABA clinic is trustworthy? That you can kind of see that trustworthiness and transparency coming through, maybe even when they go in just to take a tour?
Sure. Yeah, so I think touring a facility is really important, and not all clinics allow you to tour. So that would be my first number one. Like, we should be able to go in and see what's going on here. So touring's really beneficial, so you can kind of see how the technicians are interacting with the kiddos. I know we get a lot of parents where they're brand new to the world of autism in general. So they might know what the word ABA means, but they have no idea really what it looks like. And especially like reading all the things online, it can be really discouraging. So being able to walk into a clinic and see the interactions with the technicians and kids, you should be seeing the kids smiling, laughing, enjoying. And I'm not saying every single moment of ABA is rainbow and butterflies. We're human. Yeah. We're all people. The kids that we work with are people. They're kids at that. So behaviors are normal, right? And that's something that we're all working on how to support them in. But there should be real connections there. You should see kids having true relationships with the kids there. Other things, incident reports. I know we do a lot of incident reports. If a kid has any sort of redness, our parents are probably a little annoyed with how many incident reports we do, but
we're thorough.
Yes, but we do want to be transparent. If a client gets hurt where they hit their head, I'm calling the parent right away and talking about it, and just answering any questions that they might have, because we all know kids do get hurt. They trip, they fall. A lot of kids with ASD have other comorbidities that impact their balance and their core strength and the way that their body feels in their environment. So it is common for them to trip and fall and whatnot, and we just want to make sure we have transparency with that. So those are the big ones. Parent meetings. Should be having parent meetings with your clinician. We aim at least once a month. But that is a great way. It makes such a huge difference for your child if you're involved in their care. We want to make sure the skills that we're teaching here will work at home, and if they won't, then we need to change what we're doing here, or explain, okay, maybe we're going to start it this way, but the end goal is to do this, right? But we got to meet the child where they're at and kind of build up those skills to get there. So having parent meetings should really give you a good idea of how familiar the clinicians with the client, and it should make sure that there's that collaboration and care. It should be values. Our values should be aligned. That's another huge piece. I know if I walked in and I had a child in therapy and a clinician was saying that they were working on a skill that I don't have any value in. I've worked, with some parents who feel like social skills is just not something that they are wanting to work on. They feel that the child has some relationships and they really like to be on their own, and that's okay. And if that is their wishes and there are other things that we can work on and that all of our values align, we're going to work on those things that align. So we want to make sure that, we're having those conversations and able to collaborate together and collaborate with other healthcare professionals on the team too.
Yeah, so I guess tell me a little bit about what that would look like. How do you need to collaborate with other professionals sometimes in this field, since there are those comorbidities oftentimes?
Yeah, so talking to them, having meetings, I think that is huge. I know we meet with our Empower Eyes. They do our PT, OT, and speech, and we meet with them weekly or bi-weekly, or if you have a question, we reach out. It is so insightful to have those pieces of the puzzle. There have been times where I've worked with clients, for like a year, and I'm like, man, they're not getting this skill, or I'm seeing them having really challenges and being regulated, and just can't understand with just my scope of practice why that is, right? There's like other mysteries that are contributing to how the client feels or interacts with their environment, and having those other specialties in care with the clients is so eye-opening to understand those other diagnoses and how we can work together to best support the individual. So I think meetings and having that open communication, sharing reports back and forth, and we do the same thing with our behavior interventions, right? So sometimes behaviors can impose other challenges with working with other staff members. So if they're having challenges, we can hop on over there, we can model some things, we can provide extra behavior support, and kind of teach them the strategies that we use that help with the client to support them and help them be successful.
That's awesome. So I guess the last question we will do today is kind of on that same topic of having our speech and our occupational on site. How does that collaboration look? So do you guys meet regularly to talk about how things are going? I don't know, is there an example or something?
Yeah, so we meet bi-weekly typically with them. And then we are sharing all of our documentation too. So they see our full 6-month or initial report and our behavior interventions before we're kind of going into their assessments. And then during those bi-weekly meetings, we ask questions, but we're both available, in between that time span. So there's oftentimes I'll just see, the speech path walking in the hallway, and I'll go up to her and ask her a few questions about when's, this kiddo getting an AAC, or that kiddo, or hey, I've been working on this, but I'm running into some barriers. What are your thoughts? Mm-hmm. So it can look a few different ways, and it's just so nice having them on site for those reasons, right? Or we might have a client that's really dysregulated, and we've tried, a lot of tools in our toolbox, and just having another professional's eyes on those behaviors to, again, just support. So
yeah, that gives you another perspective, a different angle to kind of see things from.
Mm-hmm.
I feel like the theme of this live has just been, your ABA clinic should have transparency. They should be open and honest. There should be that communication. There should be that collaboration. You should be able to tour the facility before you sign on. So all of these things, making sure that you're comfortable with the services that are being provided. They should be aligning their values to yours, so you really are getting your needs met and your child is happy at that clinic. So thank you all for joining. We're looking forward to doing these again. If you guys have any questions about autism or ABA, it's not too late. Comment on one of our videos. Feel free to DM me and we will answer them next time. All right.
Yes.
Bye.
Bye.